The Diagnostic and Statistical Manual of Mental Disorder is a publication of the American Psychiatric Association. It's been around for half a century now. The way it works is a classification system. It describes mental disorders on the basis of symptoms. And it provides specific definitions which will inform policies, funding, and research. Now, because the way we conceptualize disorders change over time, there will be different editions which reflect changes in the way we define these disorders. Autism is being in the DSM starting from the 3rd edition, and in the 4th edition, which was published in the 1994 and is being used until now, this category of pervasive developmental disorders, in which autism was part, was characterized by a number of different types of autism, which we can call subtypes, including autism, Asperger's disorders, and other disorders that were similar. What is happening in this new edition, which is coming up in 2013, all of these different subtypes are going to be merged in only one diagnosis, which will be autism spectrum disorders. So what happens is that children who now meet criteria for autism and children who now meet criteria for Asperger's disorder or the other autism subtypes, they all going to have the same diagnosis, which is autism spectrum disorder. The work conducted at the Olga Tennison Autism Research Center informed some of the most relevant and controversial changes in the DSM. In particular, Cheryl Dissanayake published in the 90s a number of works and reviewed the literature about the differences between the different subtypes of autism, finding that they're all more similar than different. And Margot Pryor and colleagues in the 90s found that the differences between different subtypes were quantitative difference, the degree, the severity of autism symptoms rather than qualitative differences. So based on these studies, the DSM-5 committee made the decision to merge these different subtypes into one single diagnosis. The Olga Tennison Autism Research Center position is a pretty positive one based on the fact that we believe that the changes that were introduced in the DSM-5 are motivated by research and evidence-based findings as opposed to lobbying and negotiations. This is one of the main concerns when you have a new definition of autism or a new definition of any disorders, is that changes are motivated by reasons other than results of research. For example, changes in the policy or changing the access to funds and so on. We believe that this was not the case, and each single decision that was made by the DSM-5 committee appears to be motivated by science. Having said that, there are a few of those decisions that we believe are controversial and deserve some more thinking around, and we are pretty critical around some of these decisions. There is a possibility that people who currently do meet criteria for autism would not respond to a criteria for autism under the DSM-5. And in fact, these preliminary studies that were published do suggest that less people will have a diagnosis of autism under the DSM-5. Now, the point is, it's not a bad thing in itself if the numbers change. In fact, if the DSM-5 was diagnosing the exact same amount of people with autism, then there should be no need for a new edition, a change in the classification. The fact is, those who will be diagnosed are the ones who do need actually services and funds, or are we not diagnosing children who do need funds? It's the preliminary data suggests that the change will affect probably around 10% of the children. Now, what we really need to understand is whether those children who don't meet criteria anymore are children who actually do need funds. And at this point, the debate is open. We do believe, anyway, that it's not that the instrument is good if it classifies as autistic a lot of children. It is good if it does classify as autistic those who really need. And in terms of rationalizing resources, it's a good instrument if it does capture, if it does include those kids with autism who do need services, as opposed to just lots of children. We do believe there are a few reasons of concerns. The first one is there is a possibility that the next edition of the ICD, which is the International Classification of Diseases, which is provided by the World Health Organization, will not be harmonized, will not use the same criteria that are used in the DSM-5. So there is a risk of having two different classification systems. And this is due to the fact that there might be reasons for the committee working on the World Health Organization classification system not to agree with some of the changes operated by the DSM-5 committee. There is also some concern around the fact that the presence of repetitive behaviors becomes really, really relevant at this point under the DSM-5 to diagnose children. Under this new classification, children will have to show at least 2 instances of repetitive behaviors. And while this is it's motivated by science, again, by the fact that research identified this as a very relevant feature, it might be that clinicians, pediatricians, people doing diagnosis out there might not have the training that is necessary to capture and adequately recognize those behaviors. Another problem is that the DSM-5 introduced a new category, which is called social communication disorder. It's not part of the autism spectrum disorder, but it's very similar to autism because it does involve difficulties with the social use of communication. Now, children who now meet criteria for Asperger's or autism or other subtypes of autism, it might be that some of these children, if they don't show clear repetitive behaviors, will be classified under this new label, this new diagnostic category. This does involve some risk because currently, being a new condition, being introduced now, there's no legislation, there's no guidelines, and there are no treatment policies that can guide decisions on children who will be now categorized under this new label. So these are all reasons of concern. At the same time, it's really important to understand that every change in classification will involve some problems until we find a way to define autism on the basis of genetics or biology or pathophysiology, or understanding the nature of autism from a point of view that is explanatory, understanding what are the mechanisms underlying autism as opposed to how these children look like, and putting together children who are similar in their symptoms and their behavior.